Dr. Rodney Rohde, professor and chair of the Clinical Laboratory Science Program in the College of Health Professions at Texas State University, joins us now to talk a little bit more about the monkeypox virus. Thank you so much for being here. We appreciate it.
Good morning, Josh. It's always a pleasure joining.
Good morning. So let's start off by talking about that 1.8 million doses, because it does appear the U.S. is speeding up its vaccination efforts. And what does that mean as we're seeing this virus start to spread?
Sure. And as you just said, so the U.S. right now has a little over 14,000 cases. It's important to remind the public that there are 0 deaths in the United States from this virus. So it's unlike COVID with respect to how it spreads. It primarily spreads from person to person through close, prolonged contact. Typically that's skin to skin, but it could also be skin to fomites, which is just a fancy word for things like bed linens or clothing or things like that. So while it historically in places like Africa is endemic and has been spread through contact with rodents and other people, this is a much different strain here. It's the one that's only causing about 1% fatality. So it is important. The U.S. is concerned, and the release of the 1.8 million vaccines really ties back to that declaration of a public emergency last week. So it just opens up more opportunities to get that vaccine and treatment out.
Of course, and you kind of talked a little bit about this, but the difference between COVID and monkeypox, it is not the same type of situation.
It's not, Josh. SARS-CoV-2, which we're all familiar with now, which has caused the pandemic for the past 2.5 years, is a aerosolized, rapidly spreading, much more dangerous virus, especially in the beginning. Remember, we had no vaccine, we had no therapeutics. Monkeypox is different. It's a DNA-based virus. It mutates way more slowly than an RNA-based virus like SARS. And we already have vaccine ready. We have TPOXX, which is a therapeutic. And in many ways, we should be using the lessons we learned during COVID and even going back to HIV, right? So we have infrastructure in place for vaccine delivery. We have infrastructure in place for understanding how to get public messaging out, and we need to move forward in what I'm calling a concerned effort, but not an alarmed effort, because we are really not at a pandemic level or anything like that.
That's what a lot of people have asked here is, why are things not being shut down like during COVID? But that kind of answers that question right there. So talk a little bit more about how the virus is actually transmitted.
Sure. So, and again, that's a fundamental difference. And it's really important for everyone to understand. It is prolonged. Most research says up to 3 to 4 hours of skin to skin close contact. It can be acquired through the respiratory route, but it's much more difficult. You would have to be around somebody for a prolonged time. It almost would have to be something where they're right in your face, coughing, speaking, things like that, sneezing. So it's most likely, and it is the primary way it's been transmitted so far, is through skin to skin contact, including through intimate behaviors and things like that. So COVID, as you remember, SARS-CoV-2 is aerosolized, especially as we learn more about it over the first year. Really rapidly spread. You could infect people in one room from one positive person, just dozens and dozens of people. Monkeypox does not work that way. It's a much more difficult, inefficient transmitter.
As far as the actual vaccine goes, is it the vaccine for monkeypox, or is it, how does that work as far as the vaccination itself? Was it meant for monkeypox?
Yeah, great question. So there's 2 vaccines. There's one called ACAM. That's actually for smallpox, and smallpox is a cousin of monkeypox, and so it does offer protection. It's just that most people have kind of stopped using that around the world, but it is there. But the other one, Genos, which is the one that the U.S. has been continually ordering and ramping up for, is a monkeypox vaccine that does help prevent the acquisition of the infection. So the vaccine is there. And again, early on, there were some, worries that we didn't have enough of it. And certainly now we've ramped that up and we're starting to get that out and move it to the states that are most at risk. You mentioned some of the higher level states. And so the idea is that you kind of do a risk assessment of the number of cases and where that vaccine is needed.
And at this point, how do we stop the spread? Because we are seeing more than 14,000 cases so far confirmed in the U.S. since the start of that outbreak? What can be done to stop the spread?
Right, great question. It will be difficult, but it's not impossible. Remember, COVID, once it got out of the box and due to the aerosolization and spread in asymptomatic cases, was really difficult to contact trace and to kind of stop it. With monkeypox, theoretically, if we identify the positive cases and then identify the close contacts, for example, family members living with someone, close colleagues that might have been with someone, or even partners with intimate behavior, then you can vaccinate those. It's kind of a ring vaccination. It's kind of classic public health. So you get people vaccinated around that case, and then people quarantine and isolate, and theoretically you could stop the chain of transmission. It will be difficult with over 10,000 cases now, but it is doable with good public health efforts, which will take boots on the ground and consistent, sustained efforts.
And I know that I was hearing somewhere that it's 1/5 of the actual dose is how they're doing it in order to preserve and help give it to more people. Is 1/5 as effective?
Yeah, the makers of the vaccine have determined that it is. I think we will watch and see. That is definitely something that I'm going to be watching, and other experts will be watching with, expertise in immunology and vaccinology. So that is one way to help, disseminate more of the vaccine. If you can get 1/5 of the vaccine to work, then certainly you increase your dose supply in a hurry. But I'm sure everyone will be watching that, making sure there's no what we call breakthrough infections. But they have stated that they have tested it in the house, and now we'll watch and see if it's reproducible in the population.
All right, doctor. So is there anything else that you want to make sure that people know about monkeypox in general? I know you're very well versed on this topic. So what do you want the public to know?
Yeah, I think really primarily important right now is that we watch this virus out of concern. If you suspect or see anyone that has lesions or flu-like symptoms or things like that, you should at least be thinking about this virus. It may or may not be it, and that's the frustrating part. But certainly if you know you've been in contact with somebody that had monkeypox, or you see on yourself or those around you lesions or pustules and things like that, you should get tested through your primary physician or through the local health department, so that we can get you in isolation and get you treated. Keep in mind, again, 0 deaths in the United States. This infection resolves within 2 to 4 weeks, so it's just much different than something like SARS that was so unknown and scary 2 years ago.
All right, Dr. Rodney Rohde, thank you so much for joining us today. We really appreciate it. Some great insight there, and I'm sure we'll be talking to you again in the future.
Thanks, Josh. Have a great day.
You too.